today we have two great guests with us. They are here from the Ceresti company based in Carlsbad.
Correct.
One is
Dirk Soenksen,
who's the CEO, and the other is Nicole McPherson, who is one of their caregiver coaches. Thank you so much for being with us
It's
today.
our pleasure to be here.
Appreciate
Thank you for having us.
Yeah, thank you for coming in and joining us today. So tell us about Seresty.
Well, so Seresty is really focused on the challenges that families have in the home when they're taking care of a loved one who may have Alzheimer's disease or another dementia. And so the essence of our program is that we really empower the family caregiver to provide better care for a loved one. Right? So if you sort of think about the challenges in the home, they're then exacerbated if an individual also has, let's say, heart failure or pulmonary disease or diabetes, because one of the things that happens when you have Alzheimer's disease is you lose the ability to self-manage, to take care of yourself, to sort of address the challenges of your chronic condition. And so one of the things that happens is if you can't take care of yourself, you end up going to the emergency room, you end up going to the hospital, and that's not good for the patient, that's not good for the system. And so our program is really sort of founded in helping address the challenges of chronic conditions, the inability to self-manage, and of course, who's the best person to help with that? It's typically a spouse or a baby boomer child who's providing care for a loved one. And we really, as we'll show you, we sort of have a technology-enabled program, a dementia care program that empowers that caregiver so that they kind of know what to do. And in our healthcare system, people with dementia are largely forgotten. Everything that happens in healthcare is focused on people who can sort of self-manage. I can give you an app, I can send you something to read, and none of that will work if somebody has a disease like dementia, a stroke, or a brain injury. And so that's really where we come in.
So it could also be used for somebody with a traumatic brain injury.
That's exactly right. So if you broadly cast us as patients or people who are living with a disease that makes it impossible for them to take care of their own chronic conditions, we're starting with dementia. That's really from a marketing perspective, the biggest number of people who have that. But it goes to stroke, it goes to traumatic brain injury, because the challenges there are in some cases longer. Somebody can live with a traumatic brain injury for 30, 40 years, and the stress on the caregiver is unbelievable. Yeah.
So when you're on the phone as a caregiver coach, are you focusing mostly on the 7 aids of daily living? Are you focusing on just the daily routine? How are you, I know it's probably specific to the client's needs,
right.
But how do you begin the process, I guess?
Right. Well, we've built a program and we provide them with education that's very relevant for their own caregiving situation. It could be video-based, it could be a reading, we could be having a discussion, but everything is really personalized for that caregiver and that caregiving situation for them. So we might be having a discussion on a video about UTIs. That's something very prevalent.
Oh, yeah.
And it causes a lot of
really
trouble.
UTI being?
Yes, urinary tract infection. Excuse me. Thank you. And so that could have been their topic for the day. They could have watched a video or read a synopsis, and I'll be there just to make sure that they understood what they watched, that they got some value from it, so they can then take that information and put it into practice.
So I'm going to back up the truck a little bit. Beep, beep, beep. How does this work? I mean, okay, I'm concerned about mom, or my mom,
Right.
my dad has been diagnosed with dementia. I call Seresty up, and what happens?
Yeah, so this is really the question to sort of how the program works. So, the whole program sort of starts with us shipping you a tablet device, right? And that tablet device is really just a way for you to get access to the program. So we send you sort of a, an off-the-shelf tablet. Now, this has been optimized.
They're not playing lacrosse.
Well, this is actually, these were my family pictures.
Okay.
So the default mode are family pictures. So there's a smartphone app that other family members can have, and they can send pictures and messages. So the default here is that it's just circling through. It's
so they don't get scared. They actually see it, and it's something they
exactly.
recognize.
So this tablet is intended to be always on. It is designed to be sort of senior friendly. So you can't go to Google, you can't watch Netflix. It's a cell connection, so you don't need Wi-Fi in your home. And it's really just a device that facilitates access to the program. The program is really about the interaction of the coach, coaching a family caregiver in a sort of a very personalized way. So take the situation where you're caring for somebody maybe with moderate stage Alzheimer's disease, and maybe they have several challenges, like they're prone to urinary tract infections, or maybe they have a challenge with wandering. Well, as a family caregiver, you really don't want to know about all the different types of dementia and all the things that could happen. So say, these are my challenges today. I want to learn best practices for how do I deal with that.
Right.
So the personalization of the program is almost the essence of what Seresty does. So under the hood of all of this beautiful coach and great tablet and so forth is a personalization engine that really tries to personalize our approach. We look at almost the patient, we look at what chronic conditions they have, we look at their caregiver, we look at their strengths and weaknesses, and we essentially develop a program that plays to the strengths of the caregiver, that maybe minimizes things that they're going to be not so good at, and then the coaches sort of reinforce that. So every patient-caregiver diet gets a different program. Right. And that's all facilitated through the technology in the tablet. It's just really the way in which they can access this. It's an always-on device, right? It reflects the sort of picture books when it's not doing anything. And then you basically have a daily care plan that sort of says, here's what we want you to do in terms of taking medications, here's what we want you to do in terms of additional education. And then, at Nicole's end, she kind of knows what's happening because we have a dashboard that sort of says, well, they watched that video, and then she can follow up, says, what did you think? Was there any questions? And we can really make sure that we're allowing that caregiver to gain the knowledge, skills, and confidence that will allow them to really do what? Provide better care. And what does that do? That means you're making sure that urinary tract infections and falls are minimized, and then you're essentially keeping folks out of the emergency room on the hospital. And then, as a business, our customer is actually the insurance company, right? So unlike sort of saying, well, you as a consumer should just buy this, we're sort of saying, look, we can prove to a payer or an insurance company that we can reduce healthcare costs. And so our model really is that this is underwritten by the insurance company. It's offered as a benefit to somebody, let's say, who's on a Medicare Advantage plan. And then, they run a program. We have different types of programs. We have a 12-week program that, is fairly popular. So, in 12 weeks, you sort of get a heavy dose of education. And a big part of the education is focused on how do you manage that changing relationship between somebody who has dementia and a family member? Because invariably, that's where things fall apart. That person that you've maybe lived with for 30, 40, 50 years, who now can't remember your name, who maybe, because of their disease, is starting to show some behaviors. How do you make sure that doesn't become an anger-filled situation, but something that's compassionate and full of understanding? And so we spend a lot of time in our program, and we bring a lot of really excellent education to a caregiver so that we almost give them a new pair of glasses, so that they look at the situation that today might be, I don't know what to do, to, now I understand what's happening. And the goal is really to live through this disease with the entire family with the highest quality of life possible.
And just to have somebody to speak with is huge, because you feel so alone sometimes and you don't know where to turn. And you could be on the internet for hours trying to find what you need, and you're never going to find it. Trust me, I've been there. So could let's say I've just been diagnosed with mild cognitive impairment. Would I be able to manage that on my own initially, or would you not suggest I do that?
So when it comes to mild cognitive impairment, there's probably things available on the internet you're still able to sort of access yourself. We're really focused, and primarily because the business model is to save costs, the costs for somebody who has chronic conditions and is sort of challenged by dementia or something are much, much higher. So we wouldn't get somebody to underwrite this program if it was for MCI.
Got it. Okay.
Right? So this is really strictly focused at the moment on, Alzheimer's disease, and it will in the future focus on stroke and traumatic brain injury.
So at least, let's say, 3 to 4 of your aids of daily living are being compromised in some way.
Yes, that's correct. That's correct. And I think at some level you probably have to be past sort of any denial about what's happening. So you sort of say, look, I'm faced with this. How do I deal with this incredible challenge? And it turns out that there are professional tools available that are used to train professionals in communities, for example, or in memory care facilities or in skilled nursing facilities. And those are not available to the home. So we've licensed a lot of that content, and then we have sort of curated it and made it available in digestible chunks to somebody in the home. So not that we want to complicate this, but we're kind of giving professional grade training to somebody in the home, something that they've never had access to before, something that's previously been reserved for people who are, professionals who are providing this level of care.
Is that your role, Nicole? I'm trying to.
Right.
So you're like manning the phones, or?
Well, and I have a lot to do with the program as well. Just again, making sure that it is personalized for each family and caregiver, because I really am there to form a relationship with them. So I am that person that they can press their contact, their coach button, and I'm going to call them right back. And if they're maybe experiencing something that isn't on their tablet that day, I can send them some information, some resources, a reading, a video. We have a lot of different tools that I can provide them with, but I am there to talk through things with them. Maybe they have some questions on maybe a chronic condition like diabetes, and while I don't get too in-depth with medical information, I do have a lot of experience in the field and can just share my experience with them, maybe some tips, maybe some strategies, and I'm there to coach them through the program. They don't just get the tablet and they're on their own. So it really does have that personal touch. Yes, it is on a remote basis, so I'm not in their home with them. But really, I think that's a really great positive, because we're not limited by my geographic location. So a coach can be across the country and still have access to their caregivers all over the country, and provide them with that support that they might not get in their home.
What happens if you think there may be some drug interaction taking place? Do you make contact with the physician, or suggest the caregiver make contact with the physicians?
Yeah, so it's a really good question. So when we have sort of a medical program, we have a program we call the Prevent program, which is really intended to sort of help somebody, stay in the home safely, and we prevent admissions to the emergency room and so forth. In that case, we're working collaboratively with the provider group.
Okay.
And in some cases, we may even get out of their out of the electronic medical record, we may get access to some elements of their care plan. And of course, we don't just put that on the tablet, but we sort of say, well, what does that mean you should be doing every day? And we may have a medication list on the tablet that's current. And maybe that caregiver can take that to the physician with them and say, here's the medications that my loved one is taking. One of the things we do, for example, at the end of every day, through the technology, we ask the family caregiver to complete a daily assessment. So think about it. We say, how was your day? How was your loved one's day? Even that gives us a lot of information, and it'll trigger a call from Nicole if there's some sort of a spike. And then we ask questions like, was there a fall? Did you take a new medication? Did you go to the doctor? Is there new behavior? Right? And it can be personalized for the challenges they face. And based on those answers to the daily assessment, we may alert a provider, sort of saying, look, this patient has reported a weight gain. Maybe they have congestive heart failure. We think that's an opportunity for you maybe to give them a call and make sure that they shouldn't come in for a visit. So on the healthcare side, we're not making medical decisions, because if you were a doctor, you'd be like, who are these guys from Ceresti? What do they know? So we really want to simply take, exactly, we want to take their care plan, and we want to kind of almost make that family caregiver an extension of the care team. Right? So if you think about what's happening demographically with family caregivers and so forth, we're going to have a shortage. Of course, people can't afford necessarily to pay for some of these services, particularly if it's a long-term disease. So in some ways, we're kind of giving the caregiver training wheels so they can sustain themselves longer. And of course, then they get access, sometimes through our recommendations, to care. If somebody needs home care, if somebody looks for a recommendation to a community, they've asked us that, and we will, in many cases, make some suggestions and sort of say, here's what's available in your community.
So Dirk, I'm just going to try to wrap this up from a business model standpoint. And that's what I'm trying to wrap myself around, is like Patty and I got to meet the Poway daycare center.
Yes.
And would that be a place where you would like to go and demonstrate to the folks? And I mean, I know it's insurance, but is it self-pay possibly, where you could then demonstrate to the people that are dropping off their loved ones at the Poway daycare center to say, hey, this is something that could help you stay in your home longer?
So Ron, you bring up a great point about community resources. So one of the things we also do is we curate kind of local nonprofits that provide services, whether that's adult day healthcare, whether that's maybe a respite program that could be offered by any number of nonprofits. And then if that's appropriate for you, it'll just show up on your tablet. Now, the business model really is, we'd like this to be underwritten by either a Medicare Advantage plan, or by, we think in the future hospitals may reimburse us when somebody's discharged. But until everybody's sort of covered, we have a private pay option where people can come to us, they can access the program, they get the benefit of a coach like Nicole. And that's done privately, and we probably won't go very medical in a program like that, right? Because we may not have a relationship with that family or caregiver's providers.
Got it.
What's
What kind of feedback are you getting from the caregivers that you've worked with to date? Because, like I told you earlier, I wish I knew you 12 years ago, because it's a very long and very frustrating road.
Well, I've been able to work with many different families, many different backgrounds, locations, different diagnoses, and progression of dementia, whether that be in the earlier stage or the later. And we've really got some great feedback about the Seresty program. We've been able to help these families, learn a lot and feel more empowered in their home. They don't feel so lost and confused. And they know that I'm there. They know that every day something helpful is going to appear on this tablet, and they can also have a conversation with me.
A lot of times you wake up and go, oh my God, what is today going to bring?
It's never the same.
And you're almost afraid. You're almost afraid for the sun to rise.
Right. And it is very scary for them at times, and we really want to try and minimize that, because if you're scared, you can't be a great caregiver. If you don't know what to do, you're not going to provide the best care, no matter how good your intention is. And these unpaid family caregivers have an extremely hard job.
Even the paid ones.
Right, even paid, of course, of course. But these caregivers that I work with, they don't have sometimes support coming into the home. And it's really on them. And I'm there just to support them through that.
Well, we thank you both for being here today.
Yeah, it's our pleasure. Thank you.
Nicole and Dirk, and we wish you the best of luck. Stick around for more Senior Stay or Go TV.